Hi, everybody. It's Olayinka and Olayinka, and I'm just waiting on our co-host, Ibukun, so we can start this live video. Hi, everybody. Thank you for joining us. Just waiting on Ubo to join us so we can start this video. Hey, I see we have a couple of followers. Just give us a minute here. Here comes Ibukun.
Hello.
Hi.
Hi. Nice to
Nice
see
to
you
see you.
again. Awesome.
Yeah.
Yay. All right. All set? Are you
Yeah,
ready?
all set, ready to go.
Sounds good. Okay, so hi everyone. My name is Ibukun and I work at Whitman-Walker and I'm here with Ollie. Do you want to introduce yourself?
Absolutely. It's me. I'm back again. It's Olayinka Canola Hadley. I'm a physician assistant. I work at Whitman-Walker as well. My pronouns are she, her. I'm excited to have this chat about boosters and third doses.
Oh, yes. I use she, her pronouns as well.
Yeah.
So before we get into our conversation about boosters versus third doses, I do want to mention that the Women Walkers Community Health Team, we've been doing a lot of community health outreach efforts. So definitely check out our page if you ever wanted to learn about, HIV, STI, sexual health practices. We talk about different social determinants to health. We talk about COVID, the pandemic, and just ways to, handle it. So definitely check us out for any information about that. And today with Ollie, we're actually going to talk about the difference between a booster shot and a third dose, because I know that can be kind of confusing to some people, especially just trying to figure out what path are they supposed to be taking? Are they eligible for a booster versus a third dose? So I really
Right.
think it'll be important for us to talk about it. And I do have some guiding questions for you. And there's also, Instagram has been doing this weird thing where for some people they can comment questions while other people's accounts it doesn't work. For some reason on mine I can see the comments. I don't know if you can see comments. Can you see comments?
I may be able to see comments. I don't see any comments actually right now.
Okay, there have
Yeah.
been comments, so you don't have access to comments.
Yeah.
If anyone has any questions, you can leave in the comment box and I can see them and then I can read them out to you. Is that okay?
Sounds great. Yeah.
Okay, sounds good. So the first question I have for you is, what is a booster and who's eligible for that?
Right. So the boosters have been approved recently by both the FDA and CDC for those who are over 65 years of age and have already completed their full series of vaccination,
Okay.
which can mean either you got two doses of the approved mRNA vaccines, either Pfizer or Moderna, or you got one dose of Johnson and Johnson. And the time frame varies a little bit, so we'll talk a little bit about that for when you can get a booster, and who's eligible. Those things are basically the same. But basically, for Pfizer and Moderna, if you got those doses about 6 months ago and you are eligible, and we'll talk about that criteria in a minute, then you are approved to get a booster, which is typically a lower dose of the initial vaccine. You can get any approved vaccine, any vaccine that is approved in the United States as a booster, which means you can get the Johnson and Johnson, the Pfizer, or the Moderna. And if you got the Johnson and Johnson in the initial phase, and it
Hmm.
has been at least 2 months, you are approved for a booster, and if you're eligible for a booster.
Okay.
Um, and then do you want to talk about a third shot now?
Yes, that was my next question is like, what is a third dose?
Sure.
Who's eligible for that?
Yeah, third doses are a little different because they are a full dose, typically, of the vaccine that you would have gotten in the initial phase of the vaccine series. So, whereas a booster for Moderna is half the dose, and
Okay.
for Pfizer is half the dose, then the booster or the third dose is actually a full dose of another approved vaccine. So, you get a full extra dose. And the third dose is for those who at baseline are immunocompromised and may not have reached the full level of antibody protection that
Okay.
they needed to have the first time they get it. Either they're elderly or they are organ transplant folks or have cancers or at baseline are immunocompromised. So that would mean that they would get the third dose in order to get the full series. Whereas
Okay.
for most young, healthy people who are not immunocompromised and are healthy, a booster would suffice
Okay.
if you have certain medical conditions.
Okay. Yeah, that makes a lot of sense. So basically, a booster is for individuals who already kind of like attain like full immunity already from the
Right.
doses, and then they would then get half a dose just to increase the protection, and then a third dose are for individuals who were unable to like gain full immunity or like full protection just from the two doses. So to get to that full protection, they need to get another full dose.
That's correct. And
Okay.
in fact, part of the reason that we're doing these boosted doses, not
Mhm.
necessarily the third dose, because the third dose would have been given anyway, even if you didn't need a booster if you were immunocompromised. But the booster is in response to this Delta variant and the variants to come, quite frankly. We know that Delta is probably not the last variation that will make it harder for us to stay out of hospital and off ventilators and avoid death from COVID 19. But we know that this Delta variant, as well as many other variants that may come, make it harder for folks to avoid getting infected. And quite frankly, anyone who's infected can be a vector for transmission. So we're
Yeah.
trying to keep the infection rates down in total and
Mhm.
also trying to, at the same time, keep people out of the hospital and from becoming very, very ill.
Yeah. So the next question I have is how do you decide if you need a booster versus third dose? Um,
Well,
Based on
yeah.
either or
So there are no blood tests to tell you whether or not you need a booster. Basically, it's a time frame thing. And actually, it not everyone is eligible for a booster, although I think the message has gotten very confused. Because you finished your series and it's been 6 months, or because you finished your series and you got Johnson& Johnson, it's been 2 months, doesn't mean you need a booster. If you are young, healthy, don't have any baseline medical conditions, and we'll get into what those are in a minute that qualify, then you are still fully immunized with just the initial 2 doses of the mRNA vaccines, which are Moderna and Pfizer, or the 1 dose of the Johnson & Johnson, although we know now that the Johnson & Johnson offers less protection against the Delta variant,
Mhm.
but still robust protection against hospitalization, death, and intubation from COVID-19. So still very good protection,
Okay.
right?
Um, so I guess a question I've been hearing people ask is if they have to get a booster or a third dose, does this
Mm-hmm.
mean the vaccine isn't actually working? So I guess could you speak more about that? Because I think that would be another reason why people would be more inclined, I mean, less inclined to getting the booster or a third
Mm-hmm.
dose because they might be like, it's not working, so why would I get another one?
Yeah, well, vaccines have never been a full panacea against disease or illness. What they are is an insurance policy against worsening or severe disease. So if you think about it, the protection we've had from the full series of the vaccination, either the 1 dose Johnson and Johnson or the 2 doses of Moderna and Pfizer, have offered us pretty good protection against those severe criteria and severe illness. So they are working. They are working just as vaccines have worked since we've had vaccines. Vaccines are still um, miracle things. They're still very miraculous. They're still very powerful. Because if you think about it, without the vaccine, there would be certainly many more people infected and much more transmission throughout the community, and therefore probably far more people who were hospitalized, got sick, or were severely ill. So the vaccine is working the way it should. But if you think about, lots of vaccines need a booster. Every
Mhm.
year we get a flu shot, and that flu shot is a different kind of conglomeration of the influenza that we know about. And we try and predict every year in the season what kind of flu we're going to get, what strains. And it's the same for COVID, which is also a viral infection. And the jury's out right now because we still are doing science in real time about when we're going to need a booster on a regular basis for COVID, when, if ever, because we are still at the very beginning of this pandemic and we still have lots of research to do to see whether or not the antibodies we produce are durable, lifelong. But we know that there is, in fact, waning of the antibodies. Whether or not that translates to more severe infection, the jury's out. But we know that there are waning immunities, and the Delta variant has changed the calculus in terms of whether or not we can get the virus. Whether or not we get super sick from the virus has
Yeah.
not necessarily changed because of boosters, but whether or not we get the virus is impacted by whether or not we get the boosters.
Thank you for answering that.
Right.
So you that you can mix the boosters, or you can mix the kind of vaccine you get, like if it's Pfizer or Moderna or J&J. Are there any
Yeah.
benefits to, let's say you're a person who had the Pfizer one for your first and your second dose.
Mhm.
Any benefits to like mixing and matching? What do you have to say about that?
So there are lots of studies, none that are yet fully accredited in the United States, but there are lots of studies coming out of Israel, Great Britain, and some other European countries that show potentially a greater kind of immunity by mixing and matching vaccines. Specifically, when you mix an adenovirus vaccine or a traditional vaccine with an mRNA vaccine. For instance, Johnson and Johnson, which is approved in the United States, is a traditional adenovirus vaccine. When you mix it with an mRNA vaccine, we can see a different kind of antibody response, and it is a very robust response. So there is some data to show that mixing and matching is a powerful way to boost immunity against getting the disease or getting severe disease. The other vaccines that we know are approved all over the world include the AstraZeneca one, Sinovac, Brazil has a vaccine, Russia
Mhm.
has a vaccine. Many of those are adenovirus vaccines. So if you're here and you've gotten that vaccine, it is probably a good idea to get a booster. And it's been the necessary time frame and you meet the criteria.
Okay. Awesome. So is a person still considered fully vaccinated even if they don't receive the booster or third dose?
Absolutely, they are considered fully vaccinated. You are still fully vaccinated if you got the full series. The booster is approved for the following groups and categories. If you're 65 and above, automatically you can have a booster.
Okay.
If you are 65 and above and immunocompromised, you probably need a third dose also, so that you don't get both. So you get a booster, depending on who you are and what you have, or you get
Mhm.
that third dose. In addition, if you're over 18 and you have certain baseline medical conditions, you may be eligible for a booster. And some of those conditions, I mean, they're varied, and I always have to consult the CDC website and the FDA website to figure out who's eligible. But some of the conditions, and this is not exhaustive, include
Mhm.
cancer, chronic kidney disease, liver disease, even behavioral health issues like um, mood disorders or
Yeah,
depression,
that's
schizophrenia, dementia. Diabetes certainly can make
immune.
your immune function less robust. So certainly that is one criteria. Down syndrome, if you have heart conditions, um, obesity is one that we know is a major risk factor for severe illness. And certainly any immunocompromised state, like if you have HIV, specifically if you are not undetectable and if your CD4 count is not greater than 200, which is an AIDS defining illness. So there are lots of criteria, and I would recommend you speak to your medical provider
Mhm.
before you decide whether or not you need a booster. And I know a lot of people are just going to their drugstore um, and getting a booster, and more power to them. I don't think there's anything wrong with getting a booster. It's just that you may not need it. And there,
Okay.
of course, no vaccine is benign. There's the potential for an injection site reaction, which is like a bruise or like a tenderness of your arm, and maybe some achiness or fever the next day. It's not nothing, but it's something that we tolerate, certainly if you need this booster. But not everyone needs a booster. If you're young and healthy, don't work in like a group home, not a teacher, not a medical provider, you don't necessarily need a booster. But I would ask your medical provider or someone you trust who's medically trained before you go and get a booster.
And get a booster.
Mhm.
The final question I have for you, are there any risk involved with getting a booster versus third dose? Are there any, I know you mentioned, the
Mhm.
possibility of having a adverse reaction to the vaccine, just like if you would have the first and the third dose. Are there any other risk involved?
No,
Um,
there aren't a ton of risks with getting the vaccine. So if you think about it from a historical perspective, there has never been a time that a vaccine has caused, in and of itself, the vaccine, a severe adverse reaction that is not at the time of the vaccine being given. So there are no historical long-term consequences for any vaccine we know, including this COVID vaccine. There are the potential for those short-term side effects, and those can also be mitigated by taking things like Tylenol or ibuprofen if you need that booster. On balance, I think it's more important to speak to your medical provider and get the booster if you're eligible than to worry about the potential side effects, because the side effects are likely minimal, and the risk of getting sick from COVID is probably the more severe consequence.
one final question I actually just thought about as we were talking,
Mhm.
from hearing talking to patients and stuff. Is it okay for people to get their flu shot and their booster shot at the same time, like the same day
Absolutely.
appointment?
Absolutely. I do believe on the day I got my booster, I got both my booster and my flu shot, and my arm was sore the next day. And in fact,
Yeah.
our medical director got 3 doses of a vaccine. She got a
Oh
shingles
my.
vaccine, a flu shot, and a
Mhm.
booster on the same day. And her arm was definitely sore, and she was definitely achy the next day.
Yeah.
But like most relatively healthy people, and although she works in medical care, which is another reason she was eligible for the booster, she was fine after taking some antipyretics. So it is safe to do the booster and another vaccine, unless it's a live vaccine, like there are many other live vaccines. But again, you can talk to your medical provider. It is still safe to combine a COVID booster or a third shot with another vaccine. It's efficient also.
Yeah. Okay. So Ollie, those are all the questions I have for you. Is there any
Mhm.
other pieces of information you wanted to share about boosters or third doses before we wrap it up?
I'm still really hopeful that we are very considerate that the rest of the world and the human population needs to be vaccinated. I'm
Yeah.
happy that we have resources and can provide boosters for those who need them in the United States and beyond. But I'm also super concerned about the global lack of vaccinations. So
Yeah.
I am very much hopeful that we are realizing that we really need to vaccinate the whole world in order to get out of this pandemic. It is a worldwide crisis. And although the boosters are here for the United States, the most important thing is getting everyone to get the first dose in this
Mhm.
series, the first doses in the series. Boosters are certainly a secondary priority. Third shots do complete the series for many people. So those are very critically important as well. But overall, I'm just hopeful that we realize that we really need to get vaccines um, out into the world so that we can move past this pandemic together.
Yeah, I completely agree. We actually just had a conference the other day about like global health, and we got the numbers of like, other countries that don't have, I mean, like maybe like 10% of their population is fully vaccinated. It's just crazy that like the
Mm-hmm.
US has, we're like now trying to push boosters when there are countries where like 90% of their population don't even
Right.
have to the vaccines we have. So I completely agree that we should still push, getting, I think it's better for the world to be at least like vaccinated versus like pushing just a demographic of people to get the booster. So
Sure, it
yeah.
certainly is a global equity issue. And
Yeah.
although we don't have a ton of power in it, I still like to bring it up every time because I think it's a big lack. And
Get
we
the
need to start
conversation.
talking about it more, right, in the United States. Hmm.
Exactly. Well, thank you so much for joining us today,
My pleasure.
everyone.
Yeah,
And thank you so much, Ollie. Like I always love talking to you,
yeah,
so that's great.
yeah.
So before we go, I do have to mention that we did talk about COVID today. So if you ever wanted to get vaccinated and you live in the DMV area, Whitman-Walker does offer the COVID vaccine as well as the booster shots. You can call us at 202-207-2480 to make an appointment. And we have two different locations, Northwest and Southeast. So we can definitely connect you to getting your vaccination. And if you don't live in the well, no, if you do live in the DMV, but you're unable to get in contact with us, so if you're in DC, you can call 1-855-363-0333. If you're in Maryland, you can call 240-777-0311. And if you are in Virginia, you can call 877-829-4682. And I know we talked a lot about vaccination and, just like pushing people to get vaccine or like encouraging people to get vaccines. We still recognize that some people don't want to get vaccinated. So we do urge you to still practice the CDC guidelines in terms of, wearing your mask, social distancing, limiting like mass gatherings, and just, remember to wash your hands. And also, I think it's important if you're not vaccinated is to have conversations with the people around you about their vaccination status, because that's another way to just first have a conversation. Maybe that would, convince you or, give you more information about the safety of the vaccine. But also, you don't really know if the people around you are vaccinated or not. So I think it's important to have that conversation so that you are taking the right safety measures to keep everyone safe. And before we leave, I do want to say that we have an Instagram, Facebook, TikTok, YouTube, Twitter platform over at Whitman-Walker. And we would really appreciate if you would follow us and just show us some love. And Whitman-Walker has a bunch of services, so we don't just do COVID-19 stuff. Sexual health stuff, primary care, mental health. I think I'm forgetting a lot of things. Legal services.
Trans care,
Yeah,
HIV care, infectious disease
care,
care, women's health. Come see
women.
me for women's health. Yes.
So if
Mm-hmm.
you ever need any type of care and you are in the DMV area, please don't hesitate to call us at 202-797-4439, and we'll direct you to the right person. But once again, we just want to say thank you again, Ollie, for taking time out of your evening to join
My
us.
pleasure. Mm-hmm.
And I will see you later. All
Bye,
right.
everybody.
Bye, everyone. Bye.
Bye.